take a tour of some of the tools I use daily as a CRNA. A huge portion of our job is managing the patient's airway. The most important life-saving skill you could ever learn is how to properly mask ventilate your patient. We use this almost every single day in the operating room when we're putting patients to sleep under general anesthesia. Believe it or not, there is a lot of skill involved in this. It can be very difficult to obtain a good seal, especially when you have small hands. The patient has a large beard, for example. The patient's at a very high risk for vomiting and aspiration. We actually will often skip this method and go straight to a breathing tube once they're asleep. We can use either a curved blade, a straight blade, or even a video tool to get the breathing tube in the patient's airway. Placing a breathing tube allows us to minimize the risk of aspiration, meaning vomit going into the lungs during surgery. Also allows us to administer paralysis to patients during surgery if they need it, for the patient to be very still for the surgeons to operate. I work in a hospital with a lot of large, complex cases. For patients who are sicker, I tend to place a lot of arterial lines in the patient's wrist. Using an arterial line allows us to take very close measure of the patient's blood pressure, especially one who is high risk for surgery. Favorite specialty of all time is cardiac anesthesia, which means I also place central lines for every single open heart surgery. This is what a common central line kit looks like. This is for a cordis. It's going to go into the patient's internal jugular vein in most cases. Oftentimes we look at the right internal jugular vein, and that way we can deposit medication right at the entry point of the atrium of the heart. One day a week I do obstetric anesthesia. That means I'm working on the labor and delivery floor, and I place a lot of epidurals and spinals there. 1, 2, 3, little pressure. Boop. And they should be good to go for their labor pain. I am dying to get the opportunity to start teaching these in person. Our first conference is going to be in December. Keep an eye out for that sign up.